new applications, but they do not plan holistically. We need to plan holistically. When we migrate from system A to system B, the continuity of care needs to be ensured. Server crashing, I think, is a thing of past. Probably, typically hospitals gave very worst area for the server room that is of no other use, and I have seen people peeking pans there. So if we respect IT to that level, this is the result that you will get. Now we are
one of the airport, electronic, just 1 minute, the server crashed in the airport. Do you know that?
yes, it did.
Manual, people are standing in the queue for 2 hours because checking was not possible. When there is automatic checking is not, there are problems. Even today we are depending a lot on the server data storage and all this, right?
Absolutely. So there are techniques now. We have deployed disaster recovery center in Hyderabad. So if anything goes off here, we can immediately switch over to our Hyderabad center and start. So there are ways to handle these things. Of course, investment is needed. Thank you.
That was a wonderful presentation of how practically you have implemented from 0 to 1, and moreover there was so many insights about do's and don'ts, and also about this Android, this one which we have got, the waiting time forecast. Also there is an emergency room, in AIMS they have a similar system, so I think it's very good. Thank you, sir. We keep learning from you.
Dr. Deepak Agarwal to present the token of appreciation to Mr. J.P. Dwivedi.
So now let me invite our next speaker, Dr. Paramhans Mishra, current position Medical Superintendent, Indian Spinal Injury Center, specialty ISO certified lead auditor and NABH trained assessor and trained in Six Sigma Green Belt. And awards: Indian Medical Association SDB Exemplary Contribution Award, Delhi Medical Association Excellent Hospital Administrator Award, and UCMS Alumni Vice President Scroll of Honor, Vice President Indian Medical Association SDB between 2011 and 12. Sir, please.
Good morning, everybody. Respected Dr. Mahapatra and my friends, it's always a proud privilege to be at AIMS since I'm a product of AIMS, and I must thank Dr. Deepak and Madhubala to invite me to talk to you about IT implementation. I'm not an IT person, I'm a hospital administrator, but Mr. Dwivedi has definitely eased my job and he has taken lots of load off my shoulders, so I must thank him also. I will be talking what we have implemented at ISIC. So I bring you greetings from Indian Spinal Injury Center. Just to brief you, those who do not know about this center, this is a super specialty tertiary care hospital and 150 bedded, primarily dealing in orthopedics and spine and joint replacement, but we have all other specialties like medicine, surgery, cardiology and other things. This is built by a patient. So you will be surprised to know that this is built by Major HPS Ahluwalia, who went to Mount Everest in 1965. And within 6 months of coming back from Mount Everest, he was shot in his spine in Indo-Pak War and he became quadriplegic. Anybody would have lost his hope of life, but he did not. There was no hospital to look after spine injury patients, so he was taken to UK and Italy for treatment, and there he decided that India should have such a hospital so that people who get spine injuries should be able to get treatment there. And this is built with San Raffaele Hospital in Italy with collaboration. They are the planners and they are the people who initially helped us in establishing the hospital by providing equipments and other facilities. So this is looking after so many